Hello, my name is Dr. Eric Whitman, and I'm a urologist with over 20 years of experience doing vasectomies. I have made this video to help facilitate counseling you on the option of vasectomy for permanent sterilization, permanent contraception. I will be meeting with you after you watch this video to answer any questions you have. Vasectomy is a procedure where the vas deferens, which carries sperm from the testicle, is divided and occluded. This will prevent sperm from mixing with the rest of your ejaculatory fluid in the prostate and seminal vesicles and render a man infertile. The procedure takes about 10 minutes to perform and does not require more than local anesthesia. The most important thing to know before deciding to proceed with a vasectomy is that this procedure should be considered permanent. There is a reversal procedure, but it does not always work, and it's rather expensive because it's not covered by insurance. If you are thinking that you may want a reversal in the future, then you're probably not ready for a vasectomy at this point. The second most important thing to know is that you are not sterile immediately after this procedure. Your body stores sperm in the prostate and seminal vesicles, so you will not be sterile until you clear out the stored sperm. We check for sterility after 3 months, but you should wait even longer if you haven't had at least 10 to 15 ejaculates at that point. It is very important that you continue using other forms of birth control until you get a semen sample showing that you are sterile, or you could have an unintended pregnancy. Every form of birth control has a failure rate. With vasectomy, there is a 1 in 2,000 chance of pregnancy, even with a successful procedure. That is the lowest rate of failure of any established option for birth control. Surgical sterilization for a woman requires abdominal surgery and general anesthesia, which carry their own risks. A tubal ligation also has a higher failure rate than vasectomy. What to expect after the procedure? 4 to 6 hours after the procedure is completed, the numbing medicine will wear off and there will be a dull ache in the scrotum. The dull ache at rest typically resolves within 1 to 2 days. As long as you are not very active and have some frozen peas or corn on your scrotum, you should be able to tolerate that dull ache without much difficulty at all. I recommend spending 2 to 3 days laying around on the couch to reduce the risk of developing persistent pain or bleeding into the scrotum. After the first couple of days, there will be some discomfort with certain movements, which can limit your activities for 1 to 2 weeks. I advise avoiding heavy lifting or vigorous exercise for the first week after the procedure. I define heavy lifting as anything that requires you to strain to lift it. Most people are able to return to work after 2 to 3 days, but those with jobs where heavy lifting is required may need an entire week off from work. Most of the discomfort after the procedure can be avoided by wearing a jockstrap all day and night for the first 2 weeks. The elastic of the jockstrap can be uncomfortable directly on the skin, so I recommend wearing it outside of your regular underwear, like boxers or boxer briefs, so you don't have that skin irritation. The risk of bleeding is the most concerning to me. It only occurs in 1% of scrotal surgeries, but we need to do everything we can to reduce your risk. The reason why bleeding is a risk in the scrotum is because the scrotum is a loose sac, so even a minor ooze won't stop until there's pressure. The pressure is caused by a collection of blood called a hematoma. If you do develop a hematoma, it will delay your recovery and may even require another surgery. The activity restrictions I mentioned earlier will reduce your risk for hematoma, but it's also very important that you don't take any medications that thin your blood for a week before the procedure. These medications include all of the anti-inflammatory pain medications like Motrin, ibuprofen, Advil, Aleve, and naproxen, and also aspirin. If you do have pain or a headache in the week before the procedure, Tylenol is fine to take. You should not restart any of these anti-inflammatory medications until 2 days after your procedure. Another risk of this procedure is pain more than expected. The pain after this procedure may limit you longer than the 1 to 2 weeks that's expected, and a very rare patient may have long-term pain which may limit them enough to require additional treatments. The risk of this is well under 1%. There is always risk of infection whenever there's a break in the skin, and there is a risk of damage to the testicle, even loss of a testicle, but both of these risks are extremely rare. To prepare for the procedure, we ask that you shave your scrotum beforehand because the hair can make the procedure more difficult to perform. The front of the scrotum, near the base of the penis, is the most important area to shave. Clippers are fine. You don't need to use a straight edge razor. We do recommend that you have a ride for the procedure, just in case you need assistance afterwards, but we don't require it. We especially recommend and encourage that you have a ride if you have a history of getting lightheaded or passing out with procedures like blood draws. Additionally, it is important that you do not ejaculate for 1 week after the procedure in order to give the ends of the vas deferens time to completely occlude. Ejaculating too soon after vasectomy can put you at risk of developing a knot in your scrotum called a sperm granuloma. If you develop this, it can be uncomfortable and may even require surgery. You'll be able to shower the following day after the procedure, but you should avoid soaking underwater for 2 to 3 days in a bath or a swimming pool. A jockstrap will be given to you at the conclusion of the procedure, but I recommend that you purchase a second jockstrap to allow you to wash the first one, as you will be wearing them all day for the first 2 weeks. Jockstraps are actually difficult to find in retail stores, but available online from retailers for $8 to $10. A plain simple jockstrap is recommended, as the supportive athletic underwear that are much more expensive at the sports stores are actually less supportive of the scrotum. This concludes the video. If you are in the office, please crack the exam room door to let me know that you've finished watching it. Thank you very much.